Hello, for those of you who have not met me, my name is Dr. Joe Childs. I'm a board-certified chiropractic neurologist, and all I'm going to do today is go over this short video on special lab panels. This video is for the new patient who has already been to our practice, has already had a neurological exam, may have been sent out for some blood work, and you're getting ready to come back to go over your report of findings, where we're going to sit down and let you know if we can help you, let you know what's causing your chronic condition, and let you know if we need to run any other tests. This video will explain to you a little more detail about these tests that we may recommend. Now, just to review, our practice is unique in that we treat patients really three different ways. The first thing we do is we do metabolic care. Again, metabolic care is specific types of nutritional recommendations based on blood panels and special tests. We also do functional neurology, which is working with the brain and central nervous system, and we do structural biomechanical care, which is looking at the structure of the spine. We're not going to talk about these things down here today. In fact, we take care of chronic conditions in our practice, so most of the people that have come in and seen us have been to multiple doctors, have tried everything, and they're looking for an answer. We treat patients with some of the worst types of chronic conditions: fibromyalgia, stroke rehabilitation, thyroid, hyperthyroidism that has not responded well to medications. We see patients with chronic migraines, and the list goes on and on. We're going to give you a specific video that's going to be specific to your certain set of conditions or whatever problem you came in with. This video is going to be basically going over the lab tests that we may recommend, the special lab tests. Now, we sent you out, most patients that come in as a chronic condition, what we do is we send them out for preliminary blood testing, which is going to look at your CBC. We're going to look at a chem panel, your glucose, a liver panel. We're going to do a very thorough look at your iron levels, your ferritin levels, a full thyroid panel, thyroid antibodies, a lipid panel, inflammation markers, vitamin and minerals. And we're also going to do a simple gluten sensitivity test. One that we run this gluten sensitivity test because it's a lower price test. It's not very sensitive in that a lot of patients will come back negative, but it doesn't mean that they're not sensitive. But if they do come back positive, then we don't need to run some of the other more advanced panels that I'm going to talk about here in a minute. So we're going to send you out for these things, and we're going to go over this when you come back. But we're also potentially, based on these preliminary blood findings, we're going to recommend other tests potentially. Some of these special panels may be as follows. We may run a Syrax Array 2, which is an intestinal antigenic permeability screen. It's a screen for a leaky gut test. We go over a lot of that leaky gut information in some of the other videos. Syrax Array 3, which is a very specific wheat and gluten proteome reactivity and autoimmunity test. It's a very, very sensitive, gluten-sensitive test. Array number 4 from Syrax is a gluten-associated cross-reactive foods and food sensitivity panel. So we're going to find out what other foods potentially you're sensitive to that may be causing inflammation in your body. We'll do a stool microbial and an adrenal stress index. These are the most common tests. We're not going to run these on every single patient, and we also have other tests that I didn't list here that we may do specific to a certain complaint, but these are our most common ones. In fact, you have a copy of what some of these tests may look like. I want you to really understand, if we do recommend them, why we are. We use a company called SyrexLabs.com. We recommend that you go to that website, learn a little bit more. In fact, you can go to our website, www.askdrchildsdrdirt.com, and there's a link there under links. You can go to the Gut Brain Immune video, which talks a lot about some of these panels that we do. Now, I want you to understand that there's really two types of researchers that are out there in healthcare right now. There's pharmaceutical researchers, and basically what they're looking for is new medications. They're looking for drugs. Most of the people that have come in and seen us are on lots of medications or have tried a lot of medications that have not helped them. Otherwise, they wouldn't be in our office. The other group is functional medicine research, which are PhDs, MDs, doctors of chiropractic, neurologists who are researching natural non-drug solutions to chronic health conditions. These are the people that are working for Syrax Labs. They are looking for answers outside of just medications and drugs. And if you're in our office, you're probably looking for an answer that's natural also. So the big question that always comes up when we sit down and we recommend special testing is, why didn't my doctor order these special tests? Well, the number one reason is your medical doctor is a medical doctor. He's trained in medicine. He's trained in drugs and surgery and things of that nature. He's not trained in what's called functional medicine, which is looking sort of outside the box and looking at nutrition and looking at special blood panels that may not be mainstream, meaning that your medical doctor doesn't know much about running these labs, but they certainly can help a tremendous amount of people, because going back again, this research is being done and it's amazing some of the changes people are getting when they look at some tests that are outside the box. So we're going to run some of these tests potentially on you. The other question is, if your medical doctor would have ordered these tests, why didn't he already order these tests? Does that make sense to you? A lot of patients have been treating for chronic conditions for many, many years, and the question is if they would run these tests, why wouldn't they have run them already? And the reason why is, again, they're not trained in these tests, and they don't have an account with some of these labs. And we do, because we practice functional medicine. The first one that we run, if you come back and you are either your gluten testing that we did at Quest or LabCorp comes back negative, then we may want to run this test. If it comes back positive, we don't need to run this test. This is a wheat and gluten proteome, reactivity, and autoimmunity. Now, gluten. There's a lot of information. I'm sure if you've been to the shopping centers and in the different food stores, I mean, there's whole aisles on gluten-free, and a lot of people are kind of confused about it. Gluten is very interesting, and we really want to look and test people for sensitivities. No single dietary protein is a more potent trigger of nervous system or neurological dysfunction and neurological autoimmunity than gluten. It's the protein that's found in wheat, okay? Now, a lot of people are confused. They're saying, "Doctor, you tell me I have celiac disease." The definition of celiac disease is a severe reaction to gluten that leads to an autoimmune destruction, meaning your own body's immune system attacks the GI tract upon exposure of gluten. Most people, almost all people with celiac disease are going to have digestive complaints, almost always. There's even more confusion with gluten sensitivity. Gluten sensitivity is an exaggerated immune response to the protein gluten, which leads to systemic, meaning through the body inflammation, and potentially autoimmunity. It's an immune response against your body. That's what autoimmunity means. It means your own immune system is attacking your own tissues. But gluten sensitivity can cause whole body inflammation, which can create a lot of things, chronic pain, neuropathy, things of that nature. Now, what's wrong with gluten? I mean, wheat seems healthy, right? Most people would say, you know, people eat your Wheaties. I mean, everybody thinks that wheat, for the most part, for many, many years, was a healthy thing to eat. Well, gluten's changed. Gluten of today is not the same gluten that your parents ate, that your grandparents ate. It's been heavily processed and what we call hybridized. Today's gluten is hybridized, which means they've taken multiple strands of gluten and they've put them together genetically, and they've made like a super gluten that's incredibly tough to digest. So the protein doesn't digest fully. And the reason why they've done that is so crops, they can get more yield from a crop. Winter doesn't affect them, cold weather, bugs, different things of that nature, insects. What happens is when they hybridize it, it becomes stronger. The problem with that is that's created a chain reaction of events of more people being sensitive to gluten. The other thing the food industry has done is it's deaminated gluten. And what they do is they treat the gluten, or they treat the wheat, with various chemicals to make it softer so it can be used in foods. That makes it highly immune reactive. And this is why so many more people are having autoimmune disease. Now, I always get this, and this is the reason why we do this video. "Doc, my gut feels fine. I went to my doctor. He thinks it's crazy that I need to get tested for gluten sensitivity. He already tested me for celiac, and my gut feels fine." The scientific literature is now showing, and this is in the Journal of the American Medical Association, I mean, this is medical research that's been done. They're finding that gluten sensitivity, or celiac disease, is likely to attack and destroy the brain and nervous system, or the nerves in your body, more than any other tissue, including that of the GI tract. What that means is Gluten sensitivity affects your brain and nerves more than it affects your gut. And you can have absolutely no gut problems at all and be highly sensitive to gluten. That could be causing you chronic pain, fibromyalgia, it can be causing neuropathy. And we've got research in the packets that we give you so you can read some of this research. Why is gluten so harmful to the nervous system? Is because it's cross-reactive. The protein structure found in wheat is very similar to the protein structure found in your nervous system. So if your immune system gets used to attacking gluten, it eventually will start to attack similar protein structures such as your nervous system, okay, and other tissues in your body. Now, most physicians have an outdated, I'm talking 1980s, 1990s, understanding of gluten, celiac disease, non-celiac gluten sensitivity. Most of them only know about celiac disease. They don't understand about gluten sensitivity. In fact, there's tons of research. I mean, over the last 10 years, there's tremendous amounts of papers in medical journals. And they don't understand some of the non-intestinal or non-gut manifestations of gluten sensitivity, meaning they don't understand that it can affect the brain and things of that nature. Your average neurologist has no idea that gluten sensitivity can cause any type of neurological dysfunction. They have no idea that it can cause neuropathy. In fact, we gave you a research paper on how gluten sensitivity can cause neuropathy, but most neurologists and most medical doctors don't have this understanding. They haven't read this most up-to-date research. The biggest reason why is because they're medical doctors, so they're really more interested in finding out what medications they can use for various things instead of finding out what could we take out of somebody's diet that could really affect their health. The average GI specialist is stuck on the celiac HLDQ gene test or the intestinal biopsy for diagnosis, totally missing gluten sensitivity. So there's really three ways of testing for gluten sensitivity. You can test for antibodies, you can test for genes, and you can do a biopsy. The gene and biopsy only picks up celiac. It doesn't pick up gluten sensitivity. Okay? Gluten sensitivity in recent research studies has been a significant trigger in autoimmune disease, Hashimoto's thyroid problems, multiple sclerosis. These are studies. Rheumatoid arthritis, fibromyalgia, psychiatric disorders, movement disorders, people that have restless leg syndrome, myoclonus, neuropathy, numbness, things like that in your hands and legs, ataxia, which is losing balance, Meniere's disease, which is a neurological autoimmune attack of the inner ear that causes balance disorders, ringing in the ears, fullness in the ears, and vertigo. I see a tremendous amount of patients. In fact, we have a couple testimonials of patients with Meniere's syndrome. Their hearing is starting to come back. They're starting to have better balance and less vertigo. Apraxia, myopathy, cerebellar disease, which is the back part of your brain, hearing loss, dementia has a link to gluten because we are more inflamed, and that creates brain inflammation. Depression. They're finding a lot of people's depression is actually caused by inflammation, and it doesn't have anything to do with their serotonin. ADHD, autism, chronic pain. These are all things, just to name a few. In fact, I recommend, we'll give you this book on the way out. I recommend you try to read some of this book, Why Is My Brain Not Working? There's some chapters that I highly would recommend. I would recommend you read Brain Circulation and Oxygen, Gluten Sensitivity and Beyond, which is Chapter 8. Chapter 9 is the Gut-Brain Axis, and Brain Inflammation. I recommend you read those. Another great book by Datis Karazin, he wrote both of these books, is Why Do I Still Have Thyroid Symptoms? It talks about why the immune system is causing 80 to 85% of people's thyroid issues. Highly recommend you read that book. We'll give you that if you have a thyroid issue. The other thing that we do is, again, this is Array 3, which is the gluten proteome reactivity and autoimmunity. Now, why is this different? Because regular gluten tests only test for tissue transglutaminase. We're going to test for glutenin, gliadin, and there's three types of gliadin, which is a molecule in gluten: alpha, omega, and gamma. We're going to test for these treated gluten, which is called deaminate gluten, transglutaminase. We're going to test you for gluten opioids, protodinorphins, which basically means that you have an autoimmune attack against your endorphins, and it can cause people to have chronic pain. This is the type of testing that we do. In fact, you can look at it, and there's over 20 different types of things that we can look at that would let us know if you're gluten sensitive, where the test that we send you out for originally, or with your preliminary blood work, only looks at one thing. Okay? So it's important that you understand that even if you come back negative from Quest or something like that, there's a high likelihood that you could be sensitive, and it could be causing your issue when we run this test. If you're positive, then we don't need to run this test. Does that make sense to you? Because we already know that you're positive from an insensitive test. We also run something called Syrax array number 4, which is a gluten-associated cross-reactive food and food sensitivity panel. And that one looks like this. And basically what it's going to do is it's going to look at casein, which is milk. It's going to look at soy. It's going to look at oats, various other grains that are gluten-free that you can be sensitive to. It's going to look at soy, egg. It's going to look at coffee, rice, potato, various other things that you can be sensitive to. You can be cross-reactive to other foods, and this is why some people that go on a gluten-free diet, they'll say, well, it didn't make me feel better. And the reason why is there's several foods that they're just as sensitive to. In fact, there's a lot of people that come back completely fine with gluten, but they're highly dairy sensitive, and they have the same reaction that they would have to gluten, only they're having it to dairy, and it's causing that whole cascade of events. So that's why we need to run this test. It's a very specific test, and we highly recommend this one. We also run a Syrax array 2, which is a leaky gut test, an intestinal antigenic permeability screen. You have an example of this in your binder there. Leaky gut is when the digestive tract becomes inflamed. The normally tight junctions in the gut become permeable to bacteria, proteins, and inflammatory agents. I'm not going to go into this into heavy detail because I do it into your condition specific, but that can create systemic or whole body inflammation. Okay, leaky gut can cause you achiness. It can cause you nerve problems. It can make your brain become inflamed because if your gut becomes leaky, then the blood-brain barrier starts to become leaky, and some of these inflammatory chemicals get up into the brain, causing brain inflammation. So if you have an inflamed gut, you most likely will have an inflamed brain. Autoimmunity it can cause. Leaky gut can cause sensitivities or more sensitivities to food. So if you have a lot of food sensitivities, a lot of times all we have to do is fix your leaky gut and the food sensitivities go away. And you can go back to eating those foods again once we fix your gut. Leaky gut looks like this. It's permeable. So what happens is food that's in the digestive tract make its way and into the bloodstream, and then you have an immune reaction to those protein particles. The gut-brain axis is the communication between the brain and the GI tract. The gut is the second brain. You have just as many nerves in your gut as you have in your brain. So if you have a bad gut, you can have a bad brain. Now, how do you know if you have leaky gut? Well, here's the interesting thing. You can have absolutely no GI symptoms. You can feel like your gut feels absolutely perfect, but it can be leaky, and the leakiness can create autoimmunity and can cause you to have chronic pain. So leaky gut may cause you to have chronic pain. But if you're a person that has bloating or chronic pain or brain fog or anxiety or depression or numbness and tingling in extremities or anything like that, leaky gut can be the cause, and so we want to test for that. Now, when we test for that, what we do is we do this test by Syrax. Okay, again, I recommend you go to syraxlabs.com to learn more about this. But we're going to check 3 types of antibodies because there's 3 types of leaky gut. We're going to test you for oculin-zonulin antibodies, actin and myosin antibodies, and lipopolysaccharide antibodies. Now, oculin-zonulin antibodies means that the cells are opening up and the tight junctions are allowing the particles to go between the cells. Actin and myosin antibodies mean that you have cellular breakdown and the food particles are getting straight through the cells, meaning they're going right through the cytoplasm of the cell. Lipopolysaccharide antibodies mean that you have what's called a biofilm in the inside of your gut that causes a harboring ground for bacteria, parasites, and things of that nature. Each one of these has a separate fix. So we're going to treat somebody completely different that has antibodies to this than a person that has antibodies to that. Okay? Causes of leaky gut. Standard American diet, low fiber, high sugar, tons of grains, sweets. People that have had antibiotics that will ruin the bacteria in your gut, yeast and parasite and bacterial and GI infections. A lot of people have parasites, and I'm not talking about the type of parasites that you get when you go down to a vacation down in Mexico and you're on the toilet for about 2 weeks or a week. I'm talking about the type of parasites that may live with you for months, years, and they cause a low-grade inflammation in your gut. You may not feel them at all. You can have stress. High cortisol and high stress hormones can cause your gut to break down. Nutrient deficiencies. Excess alcohol consumption. When I say excess, I'm talking about people that drink 2, 3 alcohol drinks, 4 alcohol drinks, 5 alcohol drinks a week. Gluten and food sensitivities can actually cause leaky gut, and then leaky gut can make you more sensitive. And if your brain is not working right, that's another cause of leaky gut. Okay, and that's why we may need to do neurological care in your case. Leaky gut will cause autoimmune disease. Celiac disease is an autoimmune disease. Diabetes type 1, Hashimoto's. MS is a autoimmune disease, meaning MS is a immune attack on your covering of your nerves. Rheumatoid arthritis, scleroderma, psoriasis, lupus, Sjogren's syndrome. These are all autoimmune diseases. Now, there's some statistics. Autoimmune diseases are on the rise. There's 50 million cases of autoimmune diseases compared to cancer, only 9 million. Heart diseases is 22 million, so we've got way more autoimmune people. And this is on a full-blown autoimmune disease. 1 in 9 women have an autoimmune disease. 1 in 12 men have an autoimmune disease. Okay, so it's on the rise. And the reason why it's on the rise is because we're genetically modifying foods, we're hybridizing foods, we're changing the proteins that we ate, and they're causing a lot of issues. There's an autoimmune progression. The first one is called silent autoimmunity. And what does that mean is you have antibodies, you're creating antibodies, but you don't even feel it. You have no symptoms. You may have a little bit of inflammation or pain, but the autoimmunity is developing. So there's a progression before you develop a full-blown autoimmune disease. So first, you're silent. You can have silent autoimmunity for a lot of years. You can have autoimmune reactivity, which means you have antibodies to your tissues. You have some symptoms, but you don't have a complete destruction of tissue. So this is when you feel lousy, but you go to your medical doctor and he tests you for lupus or he tests you for rheumatoid arthritis, and he says you don't have it, so we won't do anything. Because medical doctors, when it comes to autoimmunity, only treat with immune suppressive drugs if you have the third progression, which is full-blown autoimmune disease. So a lot of people that feel terrible have these autoimmune problems, but that hasn't developed into a full-blown autoimmune disease. Medicine is only going to treat you when you get down here, where we're going to try to treat you up here. And that's what Syrax Lab is great for, is because they are looking at autoimmunity and what causes autoimmunity. They have a panel. Now, we barely ever run these panels, but some people may be interested in this. They have what's called a predictive autoimmune screening through Syrax Labs. Predictive autoimmune screenings are this. We can find out if you're making antibodies to tissues in your body before you even have the symptoms. Array number 5 is going to do 96 tissues in your body. So we can look and say, you know what? You're creating antibodies to this tissue and that tissue and this tissue. These tissues are probably going to break down later in life. We can do a diabetes panel, which is going to look at the tissues that affect diabetes. We can do a neurological predictive antibody test, which is going to look at all your nerve tissue and see if you're making antibodies against it. And array number 8 is joint tissues. I don't run these that often because I don't need these to fix somebody, but it is interesting that we could run them to find out if we're going to have autoimmune disease later on in life, to prevent it. Prevention is the key. We need to prevent, okay? The other test we'll run is an adrenal stress test. It's going to look at your cortisol levels. It's going to look at your DHEA levels. This is real important for insomnia patients. It's a salivary test. I'm not going to talk much about this because I go over this in detail in the specific videos. The third possibility, again, that's an adrenal stress index. It looks at your circadian rhythm. You should have high cortisol in the morning, lower at night. This person was way off, and there was a complete abnormal cortisol rhythm, and they had a lot of chronic pain, neuropathy, and fibromyalgia. Okay, insomnia is another thing that we see. So if you have insomnia or you have fibromyalgia, we're probably going to want to run an adrenal stress index on you. The other thing we run is what's called a DNA stool ecology profile, and basically you can look at an example of that. What we're going to do is it's going to let us know if there's any pathogenic bacteria, any yeast in your gut, any parasites in your gut, and do you have normal healthy bacteria. You need to have healthy bacteria in your gut as well. So people that have had a lot of antibiotics, they can sometimes have what's called dysbiosis. Also in your packet, there's something on the adrenal stress index. You can read this and understand why we would recommend this. Now, I just want to let you know, we don't recommend all of these tests for every single patient. We're going to look at your preliminary blood work, and from that, we're going to be choosy and picky as to what tests we need to run to help you get better. We want to leave no stone unturned in helping you get better. We pride ourselves in helping the most chronic of patients. But we also know that we don't want to be over-test. We don't want to spend too much money. We only want to run the ones that we think are essential. So when you come back for a report of findings, I hope this video will help you understand some of the tests that we may recommend. Read up on them, read the research in your packet, and then when you come back, we'll go over everything, let you know if we can help you. Thank you very much. Take care. 3 to 5 years if the true cause of your restless leg syndrome problem is not corrected. these things tend to get worse over time. The longer you age with these things, the less your brain is functioning as well as it could, these things start to get worse. Okay? And what is it worth to you to get fixed? Now, the reason why I ask you that is because doing the things that we do in the office, it takes a little bit of effort. You know, if we find out that you're gluten sensitive and it's creating brain inflammation, we're going to need you to make that change. Are you willing to make changes? Okay? Or are you just looking for something to cover up the problem? Because we're, again, looking for the true cause of the problem, and we leave no stone unturned in helping patients with this type of problem. So I do appreciate you listening to this video. If you would like more information, what you can do is you can put your name in down below, and we will send you information on how to get a reduced cost restless leg syndrome consultation and neurological exam. If you already have come to our office, watch this video. If you're coming back with your significant other, have them watch the video, and we'll go over the findings and any recommendations for labs when you get back. So again, thanks a lot. Take care.